Did Democrats just lose their fight to keep subsidies for Americans insured by the Affordable Care Act, or has the fight just begun? Congressman Rob Menendez joins us now to share his take on the government reopening and where negotiations go from here as New Jersey's Department of Banking and Insurance projects healthcare premiums will spike by about 174% for the average family. Congressman, great to have you with us tonight. Thanks so much for taking a minute. Obviously, there was a vote held last night to reopen the government. You voted no on the bill. Tell us why.
Sure. Well, one, thanks for having me. The reason I voted no on the bill, it doesn't do enough for New Jerseyans. We've seen this administration, this Republican Congress, really make an affordability crisis worse. And that's everything from housing to health care to the price of groceries. They've presented no solutions to the American people. So, government shutdowns are tough. Like, we never want to have one, but we also can't allow this administration to continue hurting the people that we represent. So, in my opinion, healthcare, the extension of the ACA tax credits were a tangible thing that we could deliver for New Jerseyans to deliver relief in the affordability crisis that they're having. Republicans refused to engage it beyond a commitment to a vote in the Senate on it, and that wasn't enough for me. So I was a no. I'm here to deliver results for every individual that I represent in the 8th Congressional District, and we'll continue to fight for them.
Obviously, here in New Jersey, there was unanimity from the Democratic side. All of the congressional representatives voted no. Two of our U.S. senators also voted no. How do you feel about those senators who did vote yes? We know that 8 Democrats broke from the party.
That's for their constituents to decide. I'm glad that both of our senators voted no, because I think that was the right vote on this. Listen, we're dealing with an administration that was willing to put a lot of pain on the American people. Just take SNAP alone. In every prior government shutdown, SNAP has been fully funded. This administration decided not to. We're talking about people's hunger, ability to eat, and they chose not to fund SNAP. Then, when that was challenged in court and we won, they appealed the ruling. Then, when states sent out SNAP benefits, the administration said the states needed to claw the SNAP benefits back, and if they didn't, the states would be penalized. So they were willing to go that far to get Democrats to give them the votes that they needed to move this forward. That's who we're dealing with this administration. They are cruel. They lack empathy. And ultimately, I believe that is why those 8 Democrats decide to support this Republican bill to get the government back open and to stop the suffering that so many people were feeling.
We could be right back here again in just a few months. This bill only takes us to the end of January. And so it kind of begs the question, is shutting down the government really the best way to negotiate right now, especially considering the fact that Democrats didn't get what they wanted even after 43 days of a government shutdown?
Well, listen, we're using every tool available to us. And again, it's not for Democrats, right? This is not about the Democratic Party. This is about getting relief for the American people. That's what every fight we have in Congress is about, and we will use every tool available to us. Trust me, being in a shutdown was really tough for so many people in our district. I'd be at food distribution centers and seeing the increased number of people. I would talk to federally qualified help centers. It causes a lot of pain, but not as much pain as the Trump administration and House Republicans are causing the American people. $1 trillion cut to Medicaid, the largest cut in SNAP's history, defunding Planned Parenthood. Every single issue, they are making life harder for the American people. We had an affordability crisis going into this administration. What did they do? They imposed wide-ranging, sweeping tariffs that have made things more expensive, including the coffee that all of our constituents drink, right? So they are not providing relief, and if they refuse to do so, then we will do everything we can to get that relief to the American people. So no, I don't want to shut the government down again. I want this administration and House Republicans to stand up for their constituents. But if they don't do so, then we will bring the fight to them.
Let's talk a little bit about the Affordable Care Act tax credits that you were fighting for. We know that the average premium could increase by about $2,800 a year. What are you hearing from constituents? Are there concerns that people might not end up having health care insurance, might not carry insurance anymore because they simply can't afford it?
Yeah, we have a healthcare crisis. We have a broken healthcare system, and the ACA was meant to cover a universe of people that weren't on Medicaid or Medicare or private insurance. It served that role well. And the ACA tax credits allow people who are, either small business owners or between jobs have access to healthcare coverage so they can get the healthcare that they need. And so, yeah, a lot of New Jerseyans are going to be in a really difficult situation where they're having to make a decision without those tax credits whether they have health care. So that's not a situation we want anyone to be in. We want people to have access to not just affordable health care, but quality health care. The ACA gives people the opportunity to do so. And so I'm worried that people are going to go without health care coverage, which means there's going to be greater demand on our safety net hospitals, on our emergency rooms, because people too often, if they don't have health care, will try to get through whatever illness they have. But if it's too serious, where do they go for health care is an emergency room. So, you're going to see greater pressure there. It all puts greater pressure on our healthcare system. And I think the last point I'd make that's really important is people may not be on the ACA, but when less people are covered by insurance, the pool of people shrinks. And that generally leads to increased premiums, not just for people on the ACA, but for people on private insurance as well. So you're going to see the cost of healthcare skyrocket for all New Jerseyans, and that's why we fought so hard on this. We want to deliver tangible results to all of our constituents. We will continue to fight for that.
Just a couple seconds left. Does this issue end up being an effective tool for Democrats as they head into the midterms next year?
Yeah, listen, I think people are angry. I think people are struggling. And, what Democrats want to do is provide relief, provide solutions, address the issues that people are facing on a daily basis. I think people rightfully want government to work for them.
Yeah.
That is why I raised my hand when I ran for the first time. That's what me and my team do every single day, is to try to provide tangible solutions to the people we have the privilege of representing. And so I think that is the task for all of us. Democrats are in the triple minority. Republicans control the House, they control the Senate, they control the White House. They have the ability and the tools to deliver this relief to the American people, and they refuse to do so.
Yeah.
It is insane to me that people are struggling and the president's building a $300 million ballroom at the White House. It's insane to me that people are struggling to put food on their table, and the Trump administration is giving a $40 billion bailout to Argentina. That is insane to me. That is not what the American people are demanding. And with this administration and with their enablers in the House and the Senate, I believe that they will send a clear message like they did in 2025 in the governor's race. They'll send another clear message in 2026. They're ready for Democrats to lead the charge forward.
All right, that's all the time we have. Congressman Rob Menendez, thanks for taking a few minutes to talk to us.
Thanks so much for having me.